Hi there. Today we're going to talk about some real talk on menopause symptoms and solutions. We are going to discuss 3 things that you should know to help you survive this big change in your life. For those of you who are new here, welcome. I am a gynecologist and pelvic surgeon. And if you're new here, please make sure to subscribe so you don't miss my new videos each and every week. So, Menopause Unplugged. What is this series all about? Well, I realized that throughout my training, and even practicing medicine for over 10 years now, I realized that nobody really teaches you about what to expect when you go through menopause, and although it's a very normal, natural process that all of us will go through, there's really no preparation for it. There's not really a class on it. Nobody really talks to you about it. And I think because of that, a lot of us go through it feeling alone, feeling unprepared, and maybe even scared. So this series is here to give you real, honest information about what to expect during menopause and how to take control of your health at this time of your life. Today we're going to be talking about 3 things that you need to know to survive menopause. But before we get into that, if you have not checked out my video on what exactly is menopause and what are the different stages, make sure you check that out right here. Alright, so let's get started with number 1. Menopause is a natural life transition, not a disease. It's important to remember that going through menopause is a natural process that happens to all women. You are not sick, you're not broken, your body is just going through a transition, and there's a period of time where your ovaries stop making estrogen and progesterone, which are 2 hormones that have very important roles in our bodies. And that decline in hormones is what causes a lot of the symptoms that we see with menopause. When you're thinking about it as a natural life transition, you can start to think about what are ways that I can take care of myself during this time, and what are things that I can do to feel better. And it's not something that you have to suffer through, but there are definitely some things that you can do to help yourself feel better. Alright, so let's get into it. What are the most common symptoms of menopause in general? The most common symptoms fall into 4 categories. So these are hot flashes, night sweats, sleep disturbances, and mood changes, and these are very, very common. Some people experience very mild symptoms, while other people can have quite significant symptoms that can really impact their day-to-day lives. And so what exactly are these symptoms? Hot flashes are essentially a sensation of feeling very hot, often accompanied with some sweating and sometimes shaking. And it can be triggered by a number of different things. So it can be triggered by stress or spicy food or temperature changes. But many times we don't know what triggers them. They can happen multiple times a day or multiple times a night, and they usually last anywhere from a few seconds to several minutes. Night sweats are similar to hot flashes, but they happen at night. And this is actually a very common reason why people will come see me, because they'll say, you know, I'm having a hard time sleeping. I'm waking up drenched in sweat at night. And these can be pretty significant. Sometimes people wake up almost like they went swimming in the middle of the night. Because they re-sweating so much, night sweats can also be caused by other conditions. So it's important to make sure that you see your doctor and talk about these symptoms. Sleep disturbances can manifest in many ways. Not only can night sweats cause difficulty sleeping at night, but you can also have more difficulty falling asleep, staying asleep, or just not feeling rested when you wake up. And mood changes can encompass everything from feeling sad to feeling irritable or angry. And these mood changes can be because of changes in your sleep. And you might be saying, well, this sounds like premenstrual syndrome or PMS, can look very similar to PMS, especially if you're also having some hot flashes. So what else can you expect during menopause? You can also expect to have some changes in your periods. So this can be having your periods less often, or having heavier bleeding, or having longer cycles. And that's because during menopause, the ovary is not working the same way that it was when you were menstruating. So, because there's less hormones being made, the lining of the uterus doesn't break down as regularly or consistently as it used to. Other things that you can expect during menopause are some vaginal dryness or discomfort. This can be because of low estrogen levels, which can then lead to thinning of the vaginal tissues, which can cause discomfort with intercourse, or with using tampons, or with wearing certain materials of underwear. And lastly, you can also notice some changes in your body. So you can gain weight because of changes in your metabolism. And you can also notice changes in your breast tissue. So sometimes people will notice that their breasts become a little bit smaller. That's because the glands within the breast tissue shrink a little bit with a decrease in estrogen. And you can also have some changes in your skin and hair. So you might notice your skin becomes a little bit drier, or you might notice some more hair growth in unwanted areas. And sometimes people will even notice that they lose some of their scalp hair. So once you've identified your symptoms, the next step is to think about treatment options. So what can you do to feel better? Well, first and foremost, you can try lifestyle modifications. So, things that you can do that do uncost any money, but can potentially make you feel better. And these include things like eating healthy, avoiding trigger foods, staying cool, wearing layers so you can take off a sweater if you start feeling hot, practicing stress reduction techniques, exercising regularly, and getting good sleep hygiene. By doing these things, you can potentially avoid or reduce the severity of your hot flashes and night sweats. However, if you're having significant symptoms that are impacting your quality of life, your sleep, your relationships, your work, your concentration, then it's important to talk to your doctor about hormone therapy. Now, hormone therapy is not right for everybody. And there are certainly risks and benefits of taking hormones. And it's something that should be discussed with your doctor to figure out if it's right for you. And there are a number of different formulations of hormone therapy and ways to take it. And there are risks and benefits to each one of those. And it's important to have a conversation with your doctor to decide which one is best for you. There are also some complementary therapies that people find helpful, like yoga, meditation, acupuncture, which can all potentially reduce the severity and frequency of your symptoms. And I have an entire video about alternative therapies for menopause that you can check out right here. But once you've kind of identified what your symptoms are and what treatment options are available to you, the next step is really empowering yourself and taking control of your health during this time. And there are 3 main things that I think can help you do that. 1. Invest in your mental health. Just because you're not having a period anymore does mean that your emotional health is changing. And we know that emotions and mental health play a huge role in our physical health. And you want to make sure that you're practicing self-care, setting boundaries, prioritizing your needs, and finding ways to stay grounded and centered. And this can be done with things like yoga, meditation, spending time in nature, engaging in hobbies, or just taking quiet time to reflect. And honestly, this is something that I struggle with because I have such a busy life between taking care of patients, taking care of my kids, trying to make good content for you guys. And so it can be hard to prioritize self-care. But when I do make time for it, I feel so much better, and I feel so much more energized and able to take care of the people around me. 2. Stay aware of your body. So the symptoms of menopause can come and go. You might have months where you don't really notice anything, and then other months where you feel like you're having a million hot flashes. So it's important to pay attention to your body and notice any patterns or any new symptoms that might be developing. And it's also important to watch out for other health changes that can happen during this time of life. So, after menopause, your risk for things like osteoporosis, heart disease, and other chronic conditions can increase. And so, monitoring your health and making sure that you're getting regular screenings and staying on top of your preventive medicine is so important. And I have another video on what screenings should you be getting as a woman over the age of 40. So make sure you check that out right here. And 3. Establish a support network. I think that one of the hardest things about menopause is feeling like you're the only one going through it, and that is absolutely not true. And I think connecting with other women who are going through it, or have been through it, can be extremely helpful. And these can be friends, family members, co-workers. It can be people in your community or online. And just sharing your experiences, tips and challenges can be really helpful. Alright, well, thank you so much for watching. If you enjoyed this video, please make sure to share it with your friends and comment below. Let me know what you thought and what you want to hear next. As always, I want to take care of yourself because you are worth it.